Hello everyone, welcome back to Pharmacy Made Easy. Today let's see the second part of case study related questions for DHA, MOH and Haad exams. I will provide the link for the first part in the description box, and you guys know now the DHA pattern has been changed from 100 questions to 150 questions, and you have to answer 150 questions in 150 minutes. And one more important updation, that is you have to give equal weightage for the pharmacological portion and also for the calculation part and also for the cases or clinical study related questions, because right now the DHA exam is little bit tougher as compared to the previous pattern, and you have to focus on the pharmacological portion as well as you have to give the same importance to the calculation part and also the different case related questions. In this video you will get some examples for the different types of case related questions. Okay, and I took my reference from Lippincott Pharmacology textbook. If you are preparing for exams like DHA or MOH or Haad, you can definitely follow the Lippincott Pharmacology textbook. One more thing, if you like this channel, don't forget to like, share and subscribe. If you check my YouTube channel, you can see some videos on the calculation part as well as multiple choice questions and also the case studies. Here we start. The first question: a 39-year-old man who is hospitalized for alcoholic cirrhosis and pancreatitis is placed on aqueous penicillin G to treat systemic infection. It is important for the treating physician to monitor which of the following blood levels. Option A sodium, option B cholesterol, option C creatinine, option D potassium. Okay, so here the question is just simply, if you are administering the aqueous penicillin G for a systemic infection, which blood level you should be monitored, or which constituents blood level you should be monitored. And here the options: option A sodium, option B cholesterol, option C creatinine and option D potassium. We know penicillin, that is an antibiotic and which mainly act by inhibiting the cell wall synthesis. Okay, so usually it is penicillin. These are administered as sodium or potassium salts. So this can lead to toxicity arising due to accumulation of these cations. Okay, so this toxicity can be avoided by using a potent drug, and by using this potent drug, we can reduce the dose as well as the concentration of the cations associating with the drugs. And the aqueous penicillin G, that is usually administered with potassium cation or as the salt of potassium cation. Okay, so usually when administering this aqueous penicillin G, when there is accumulation of this potassium occurs, that will ultimately leads to hyperkalemia. So here the correct answer is option D, potassium. Okay, so when we are administering aqueous penicillin G for a systemic infection, you should thoroughly check or monitor the blood levels of potassium. So here the correct answer is option D, potassium. Second question: a 45-year-old woman has just received a kidney transplant. She is placed on several immunosuppressants to prophylactically prevent her body rejecting the donor organ. Which of the following immunosuppressant interfere with T-cell activation by modifying the activity of calcineurin? Option A cyclosporin, option B methotrexate, option C prednisolone and option D sirolimus. So when we are dealing with a case study related question, you can see the question will be looks like a big paragraph, but if you are thorough with pharmacology topics, you can easily answer this question. Okay, so now we are coming to this question. We can simply, the question is, which of the following immunosuppressant interfere with T-cell activation by modifying the activity of calcineurin? Okay, so what you have to do is you have to read the question carefully And do not skip the question without reading. So you have to answer every question when you are appearing for DHA or MOH exam, because there are not any negative marks, so you can attempt all questions. Don't skip any questions when you are appearing for DHA MOH exams. So coming back to the question, here the correct answer is option A, cyclosporin. Cyclosporin, we know that's the drug which is given for mainly preventing the organ rejection, and it is mainly an immunosuppressant. Now let's see its mechanism of action. This cyclosporin that binds to a protein called cyclophilin and forms a complex, and this complex again binds to calcium, calmodulin, calcineurin and forms a complex that inhibit the dephosphorylation of some transcription factors, mainly NF80. When these transcription factors like NF80 is dephosphorylated, that will leads to activation of the genes which code for the mediator. The mediators like cytokine and interleukin, etc. The mechanism of cyclosporin, that is inhibition of this calcineurin complex, and as a result that will inhibit the dephosphorylation of this NF80, the transcription factor. So thereby it can suppress the formation of the mediators like cytokine and interleukin, etc. That will also leads to reduced function of T cells. So thereby it can achieve an immunosuppressant activity. This will be helpful for mainly for the patients who undergone a recent organ transplantation. So this cyclosporin, that is one of the main drug used in the patients with organ transplantation, and that is mainly for its immunosuppressant action. Okay, so here the correct answer is option A, cyclosporin. Coming to the third question, a 43-year-old woman complains that her irises have been darkening. She says that she has been taking a drug for years to treat her glaucoma. Which of the following drug is most likely to cause the increased pigmentation of her iris? Option A, acetazolamide. Option B, epinephrine. Option C, latanoprost. And option D, pilocarpine. Okay, so here the question is, a 43-year-old woman, she is taking a drug for treating her glaucoma, and which of the following drug given in the option that most likely causing the increased pigmentation of her iris? Now glaucoma, that is a disease characterized by increased intraocular pressure. So there are different kinds of drugs are used, and these drugs are mainly act by three mechanisms. First one, they will decrease the production of aqueous humor. Second one, they decrease the secretion of aqueous humor, and third one, the drugs which increase the outflow of aqueous humor. Okay, so here the answer is latanoprost. Latanoprost, that is a prostaglandin analog which mainly acts by increasing the outflow of aqueous humor, thereby decreasing the intraocular tension or pressure. Here correct answer is option C, latanoprost. Latanoprost, that is a prostaglandin analog which is mainly used for the treatment of glaucoma, and its major action, that will increase the outflow of aqueous humor, and thereby that will decrease the intraocular pressure. One of the major side effects associated with latanoprost, that will increase the pigmentation of iris. So here the correct answer is option C, latanoprost. Coming to the fourth question, a 29-year-old man with recurrent allergic rhinitis present to his primary care physician for evaluation. He states that his symptoms are more problematically lately and desired treatment. He has begun on fexofenadine. Which of the following adverse reactions is possible in this patient? Option A, anxiety. Option B, cough. And option C, headache. And option D, otitis media. Okay, so a 29-year-old man with recurrent allergic rhinitis. Okay, so the doctor prescribed him fexofenadine. Which of the following will be the adverse effect that is possible with the drug fexofenadine. Here the correct answer is option C, headache. And this fexofenadine, in case of adult, this cause adverse reactions like headache, back pain, then sinusitis, etc. Okay, so this same fexofenadine when used in children, that will cause cough, otitis media, and also some case respiratory infections. Here the question that is about a 29-year-old man. So the most common adverse effect that can be occur, that is headache. Correct answer is option C, headache. And fexofenadine, that is a drug which mainly used for the treatment of allergic rhinitis. Fifth question, a 63-year-old woman with congestive heart failure begins to have lower extremity swelling. She starts taking a diuretic and the swelling improves significantly. Over the next few days, however, she develops ringing in her ears. Which of the following diuretics is she taking? Option A, acetazolamide. Option B, furosemide. Option C, hydrochlorothiazide. And option D, mannitol. There are different categories of diuretics that are available, like loop diuretics, thiazide diuretics, carbonic anhydrase inhibitors, potassium sparing diuretics, and also osmotic diuretics. Among these loop diuretics that have a major side effect, which is ototoxicity. Ringing in the ear, that is associated with or as a major symptom of ototoxicity. So the major drugs causing this ototoxicity side effect, that is loop diuretics. And among the option, the loop diuretics, that is option B, furosemide. Okay, so with this loop diuretics, aminoglycoside, they also have this similar side effect, that is ototoxicity. This is one of the major side effect of loop diuretics as well as aminoglycoside. Okay, so here the correct answer is option B, furosemide. Sixth question, a 49-year-old man with manic depression has been maintained on lithium for long-term therapy. However, because of worsening of symptoms, he is placed on ziprasidone. The patient must be warned about which of the following adverse effects? Option A, asthenia. Option B, erectile dysfunction. Option C, hypertension. And option D, bradycardia. Here the question is about the major side effect of ziprasidone. Ziprasidone, that's mainly a serotonin as well as dopamine antagonist, mainly used for the treatment of bipolar disease, and it can be used either along with lithium or it can be used alone. Here the major side effect of ziprasidone, that is asthenia. Asthenia means the patient becomes physically weak or he feels lack of energy or lack of strength. Okay, so that is the major side effect of ziprasidone, and along with this another side effects include tachycardia, and it can also cause hypotension. In some cases it can also alter our vision, that can cause impairment to our vision. Okay, so the major side effect, that is asthenia, that can also cause hypotension as well as tachycardia. Okay, so here the correct answer is option A, asthenia. Seventh question, a 53-year-old man come to clinic for depression. He had decreased interest and depressed mood for the past 6 months. He also smokes half a pack of cigarettes a day and thinks that if he could quit, that would help his mood as well. What is the most appropriate treatment for his depression and cessation of smoking? Option A, bupropion. Option B, sertraline. Option C, imipramine. And option D, mirtazapine. Okay, so here the question that is about the most appropriate treatment for depression and also for cessation of smoking. Here the correct answer is option A, bupropion. And bupropion, that is an antidepressant and it is also used for smoking cessation. Bupropion that act by increasing the levels of noradrenaline and also dopamine, and this also helps for decreasing the symptoms associated with nicotine withdrawal. Okay, so that's how it can be used for smoking cessation, and also that's an antidepressant in action. Next question. A 58-year-old man with Parkinson's disease present to the clinic for follow-up. Recently, he has experienced an increase in his resting tremor and rigidity. He was wondering if there is a medication that could help these symptoms. What is the most appropriate treatment? Option A, benztropine. Option B, bromocriptine. Option C, ipratropium. Then option D, scopolamine. Here, the correct answer is option A, benztropine. And I already explained about the mechanism of action of benztropine in one of my previous video. You can check that one for more details. And benztropine, that's an anticholinergic, and that can be also used for treating various extrapyramidal side effects like this muscle rigidity or muscle spasms or tremors. And this will be act by mainly inhibiting the cholinergic transmission. And this benztropine, they are mainly used for this Parkinson disease. That is just because they decrease the levels of acetylcholine, and also they decrease the imbalance between acetylcholine and dopamine. Okay, so here the correct answer is option A, benztropine. So benztropine, that's an anticholinergic that can be helpful for relieving the symptoms like muscle rigidity or tremors or spasms. Ninth question. A 21-year-old woman present to the emergency department after she intentionally took 20 alprazolam 15 minutes ago in a suicide attempt. She has never been on benzodiazepines before in the past. The emergency department physician wants to reverse the effects of the alprazolam immediately. What is the most appropriate treatment? Option A, ammonium chloride. Option B, flumazenil. Option C, N-acetylcysteine. And option D, naloxone. Okay, so here the question that is, what is the drug used for treating the toxicity or poisoning or overdose occurs with alprazolam? Okay, so alprazolam, we know that is a benzodiazepine. So the drug which we should use here should be the antagonist of benzodiazepine, and the antagonist of benzodiazepine, that is flumazenil. So here the correct answer is option B, flumazenil. 10th question. A 32-year-old man present to his primary care physician because of a 2-week history of nasal stuffiness, cough and sinus pain. He is prescribed with phenylephrine. He must be aware of which of the following potential adverse effect? Option A, constipation. Option B, diarrhea. Option C, tinnitus. And option D, hypertension. Here the correct answer is option D, hypertension. And we know phenylephrine, that is a sympathomimetic, that is mainly used as a nasal decongestant, and the major side effects of phenylephrine that include hypertension, tachycardia, headache, etc. So here the correct answer is option D, hypertension. So this is all about today's presentation, and I hope this video will be really helpful for you. And thank you so much for watching this channel, and if you like this channel, don't forget to like, share and subscribe. Thank you.